Good evening. I'm Tekarima, a midwifery student, and I completed my fifth day of integration today. I was in clinic, and my preceptor and I, we saw 12 patients. And three of the things that I want to mention in tonight's video are pregnancy discomforts, herpes, and ultrasounds. So for those of us, you have been pregnant, you know there's a bunch of pregnancy discomforts, from nausea, vomit, to constipation, to urinary frequency, the round ligament pain, backaches, high and low, flatulence, the food cravings, pica, tylism, the varicose veins, acne, you name it, there's a bunch, right? And some of us have experienced some of those, none of those, all of those. But the one that I want to go over is leukorrhea, the vaginal discharge. So, there's good and bad bacteria, and there's changes all the time. That's normal. But some recommendations are to drink lots of water, to use 100% cotton panties, chones, underwear. If you go for a swim, don't stay moist, wet for too long. Change your bathing suit, swimsuit, bikini. They recommend to eat the Greek yogurts, drink the apple cider vinegar, showering, so take care like that. And then the other thing was about herpes. And one thing that we get asked often is whether or not, if you have herpes, can you still have a vaginal birth? And the answer is yes, you can. The only time a vaginal birth is contraindicated is if you have active lesions, so a breakout. But yeah, starting at 36 weeks, we give Beltrix, so take that, take care. And the third thing was ultrasounds. So I know a lot of pregnant people, women, sisters who are, have their own beliefs, their cultural backgrounds, traditions, and way of life, understanding, their epistemology on life, and they don't do them. Or if they do them, they do one. But in the hospitals, the recommendations, because I heard somebody say they had like 15, I don't know, but it's usually 3 or 2. The first one is done between 11 to 14 weeks, so your first trimester, that's the fetal aneuploidy, the NT one, and then the second one is the anatomy scan one, and that's done in the second trimester at around 20 weeks gestation. And it's to look at the fetal heart, the amniotic fluid. They do a biophysical profile. They tell you the gender of the baby. A lot of people are interested in knowing before they're born, if they're having a boy or girl. The fetal presentation, so if your baby's vertex, head down, breech, or transverse. The measurements of the head, the shoulders, your cervix, how long it is, if it's good for birth, all that. So that's the anatomy scan. But then if there's a need to follow up with something from that ultrasound, then there's a growth ultrasound, and that's in the third trimester. So yep, I just wanted to share that much. Have a good evening. Thank you.